America to your Caribou Data Science channel. Today's Friday the 13th, 2021. And we'll give a big shout out to the five people who watched this video yesterday. Of course, as we always say here at the Caribou Data Science channel, 5 views equal 5 likes. So of course, did I mention, don't forget to click that subscribe button. We're currently at 276 or something like that. Our goal is 285 by the weekend, by Sunday evening. So we got some work to do. Of course, don't forget that I said to click the like button. Most important of all, click on that share button. Share this video on your Facebook, on your Twitter account today. You can also copy and paste the link to this video into an email or text message and share it with your friends and family that way, okay? Here's a question. Why do we count COVID-19 deaths different than, say, cancer or heart disease deaths? Because in the case of diseases like cancer and heart disease, the numbers reset to zero every January 1st. We're only counting the number of deaths for that week. Okay? Okay. But yet, for some reason, for COVID-19, we count it from January and February 2020, which of course means the numbers are continuing to go up. But we'll take a look here in just one moment at the 2 years independently of each other. So you can see here 36 million cases and 19,000 deaths. This is just the number of cases for the current month. We got a 14-day moving average on top of that red line. You can see cases are continuing to increase. Okay, but the average is still well below this number up here. Okay, and the average is probably better for our purposes. Okay. What about deaths for this year? Look how the deaths have declined this year. Yes, we've seen a slight increase here, but this looks like it's starting to decline back over here. So don't panic about these numbers right there. Okay. Remember, remember what Washington University's Institute of Health Metrics and Evaluation says. They say that the single best measure of the spread of a pandemic is daily deaths, not cases and not hospital beds, but daily deaths. Okay. Here we can see the two different numbers for the years. 2020, this saw a steady increase in COVID-19 cases, but look at this down. We had this long downtrend in cases in 2021, but now again it is starting to climb back up, and it may even catch these numbers over here at some point. Okay, but anyway, so we got that right there. What about deaths? Well, look at this. Deaths saw an increase in the daily deaths for 2020. While in the first 6 months of 2021, we've seen a decrease in the number of deaths. So it's a mirror image of 2020. Okay, it's a mirror image of 2020. Now here's the numbers actually a little closer up for the cases. Up here we spiked at 254,000. All of a sudden it drops back down to here to 116,000. And all the way back down here to 24,234. So what is the actual number of deaths per day in the U.S.? Well, I'm not sure we actually know that question. I would say that the moving average is a better barometer of what it's gone, because you can see even the 7-day moving average, okay, is showing an increase. But as of August the 6th, August the 5th, we were averaging 7-day average was 109,762 cases per day. But you look at this, you can see deaths had a long declining pattern. We did see a slight, see that the 7-day moving average as of 8/5 was 481 deaths per day. Okay. Down here on August the 8th, the deaths dropped all the way down to 111 per day. Before coming back up on the 10th, 816, 342, and so forth. So, see, the volatility makes it really hard to gauge what's really going on, which is why we use the moving average line to get past the volatility and look at the underlying trend. Okay. Weekly cases, well, yeah, we can see an increase here, but this looks like this could be lower than this week here. So maybe this is the beginning of a new downtrend in cases. What about deaths? Well, this is 5,000 deaths for a week. This is 2,500. So it's a good chance that this week's the COVID-19 deaths is going to be under 25, right around 2,500. Okay. Hopefully this is starting a new downward trend also. Monthly cases. Well, look how low the cases have been this year compared to the compared to November, compared to November, December, and January. Look how low these numbers are here. We actually had 5 months in a row we saw an increase. Actually, more than that, 6 months in a row we saw an increase, a decrease in COVID-19 cases. 8 months in a row, uh, the cases have finished below this high right over here. Okay, and that's a victory. Now look at these deaths here. This is the number I want you to focus on. According to Washington University's Institute of Health Metric Evaluation, the single best measure of the spread of a pandemic is daily deaths, not cases and not hospital beds. Okay. But anyway, this of course you already saw the daily deaths. But here's the thing: 6. We can wind up with 7 straight months in a row when COVID-19 deaths have declined in the U.S. Now, this is the number of cases on average per 100,000 people. So right now we're averaging about 25 people out of 100,000 who has COVID-19. This is deaths. Well, this is 1/4 of a person per 100,000. So right now, less than 1/4 of a person per 100,000 is dying from COVID-19. Okay. You do see some bit of a flattening of the curve for cases, but it does appear to be turning back up here a little bit. Okay. And you can see a little bit of a flattening here as far as death, which is what we're looking for. We're actually looking for something like this, a very flat curve, not just a shallow climb. Okay. So America, the good news is deaths are continuing to remain very low. We've seen 6 or 7 months in a row now when deaths have declined. So that's really what I want you to focus on. Try not to spend too much time watching the news media because they're only going to tell you the most negative story they can find. Okay. The bottom line is, America, the sacrifice that me and you have made has had a positive effect on COVID-19. That combined with the vaccine is what is the reason the COVID-19 deaths are declining. Okay. Thanks so much for your time again today, America. We'll catch you tomorrow on Sunday with an updated report.